Good evening. This is All India Radio. I am Lalema Aneja Dang, and with me is Renuka with the evening news. The headlines. Centre asks states and union territories to give priority to those awaiting second dose of COVID-19 vaccine. Tells them to reserve at least 70% of vaccines supplied by Centre for second dose vaccination. Panchayati Raj Ministry writes to states to take preventive measures to curb the spread of COVID-19 pandemic in rural India. Early trend of decline in daily new COVID cases and deaths noted in the country, says the Health Ministry. Over 3,56,000 people recovered from coronavirus in the past 24 hours. Government proactively assisting all 8 northeastern states to fight the second wave of COVID-19. Telangana government to impose complete lockdown in the state for tomorrow for 10 days. Nagaland government also announces total statewide lockdown for a week from the 14th of this month. Prime Minister Narendra Modi thanks his Bhutanese counterpart Dr. Lotay Tshering for support in wake of COVID pandemic. Commerce and Industry Minister Piyush Goyal holds meeting with export promotion councils to discuss issues concerning international trade, and at least 8 people killed in school shooting in Kazan city of Russia. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons between the age of 18 and 44 years has begun at designated facilities. Well, stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. The Centre has asked states and union territories to ensure that all beneficiaries who have taken the first dose are prioritized for the second dose. Union Health Secretary Rajesh Bhushan and Chairman of Empowered Group of Technology and Data Management to Combat COVID-19 and member of National Expert Group on Vaccine Administration, Dr. R.S. Sharma, today reviewed the status of COVID vaccination with the Health Secretaries of states and union territories through video conference. Mr. Bhushan said states can reserve at least 70% of the vaccines supplied to them from the central government for second dose vaccination and the remaining 30% for the first dose. He, however, said states have the liberty to enhance this to as much as 100%. The states were asked to undertake awareness campaign for reinforcing importance of complete vaccination with 2 doses of the vaccine. The Secretary urged the states to ensure that priority groups are vaccinated. Mr. Bhushan said states have been informed in a transparent manner in advance about the COVID vaccines being provided to them from the central government channel. The next allocation for the period of 15th to 31st May will be conveyed to them on the 14th of May. States were also urged to minimize vaccine wastage. The Union Health Secretary pointed that there were many states which still needed to substantially reduce the wastage. Dr. R.S. Sharma said that COVIN will shortly provide the flexibility and feature for reserving slots for the second dose. The need for information, education and communication campaign for informing people that they should use only one mobile number for both doses for its reflection in their certificate was stressed. Dr. Sharma reiterated the critical importance of verity and authenticity of data.
India has administered over 17 crore 27 lakh doses of COVID-19 vaccine to beneficiaries so far. The Health and Family Welfare Ministry said that over 25 lakh vaccine doses were administered to the beneficiaries within the 24 hours. The Health Ministry today said 13 states have more than 1 lakh active COVID-19 cases each. Briefing media in New Delhi this evening, Health Ministry officials said 26 states and union territories have positivity rate of over 15%. Goa has the maximum case at positivity rate of 49.6% and Maharashtra's positivity rate is 22.5%. The national positivity rate is around 21%.
अगर हम केस पॉजिटिविटी को एनालाइज करें तो देखते हैं कि 26 स्टेट ऐसी हैं देश में जहां पर कि इन्फेक्शन का थोड़ा वाइडर स्प्रेड नोट किया गया है। दैट इज कि वहां पर पॉजिटिविटी 15% से अधिक है। 5 से 15% पॉजिटिविटी वाली स्टेट्स 6 हैं और लेस देन 5% पॉजिटिव वाली स्टेट्स 4 स्टेट्स हैं देश में। इसमें भी हम पाते हैं कि 9 स्टेट ऐसी हैं जहां पर कि 25% से अधिक केस पॉजिटिविटी नोट की गई है और इसी तरह से 25 से लेकर करीब 20% तक ऐसी 10 स्टेट्स है जहां पर कि केस पॉजिटिविटी 20 से लेकर 25% के बीच में भी नोट की गई है।
An early trend of decline in daily new COVID-19 cases and deaths has been noted in the country. India registered over 3,29,000 new COVID cases in the last 24 hours as compared to 3,66,000 COVID cases yesterday.
करीब 18 स्टेट्स और यूनियन टेरिटरीज देश में ऐसी हैं जहां पर या तो एक प्लेटोइंग इन टर्म्स ऑफ केसेस बीइंग रिपोर्टेड या एक डिक्रीज नोट किया जा रहा है, जिसमें मुख्यतः महाराष्ट्र, उत्तर प्रदेश, आंध्र प्रदेश, दिल्ली, राजस्थान, हरियाणा, छत्तीसगढ़, बिहार, गुजरात और ऐसे ही मध्य प्रदेश, उत्तराखंड, झारखंड जैसी स्टेट्स हैं जहां पर कि हम पाते हैं कि या तो केसेस की ग्रोथ जो है वो है उसमें थोड़ी कमी पाई गई है या उसमें एक रिडक्शन नोट किया गया है।
Karnataka, Kerala, Tamil Nadu, West Bengal, Odisha, Punjab, Assam, Jammu and Kashmir, Goa, Himachal Pradesh, Puducherry, Manipur, Meghalaya, Tripura, Nagaland and Arunachal Pradesh are showing continued increasing trend in daily new cases. As the country is registering over 3 lakh recoveries daily over the past many days, the recovery rate has further improved to 82.75%.
The centre has asked states to take preventive measures to curb the spread of COVID-19 pandemic in rural India. In its letter to states, Panchayati Raj Ministry has suggested to sensitize and facilitate the panchayats and rural local bodies towards meeting the challenge and provide leadership to combat COVID-19. The ministry has advised to undertake an intensive communication campaign for the awareness of rural communities on the nature of the COVID infection and preventive and mitigation measures. To provide real-time information on the availability of testing, vaccination centres, doctors and hospital beds to rural citizens, the ministry has advised the state governments to leverage available IT infrastructure like panchayat offices, schools and common service centres.
The Health Ministry has said over 3,56,000 patients have recovered from this infectious disease within 24 hours. So far, over 1,90 lakh patients have already recovered from this disease. Talking to media, Indian Council of Medical Research ICMR Director General Dr. Balram Bhargav said on 30th of April a total of 19,45,299 tests were conducted, which is the highest ever in the world. He said rapid antigen tests will be allowed at all government and private health facilities and no accreditation will be required. The centre has asked states to take preventive measures to curb the spread of COVID-19 pandemic in rural India.
Defence Minister and MP from Lucknow, Rajnath Singh, today inaugurated the newly set up COVID hospital in Lucknow. Speaking on the occasion, the minister said the 255-bedded hospital has been set up with the help of Hindustan Aeronautics Limited in the building of Hajj House in Lucknow.
255 ये बेड्स का ये बनकर ये कोविड हॉस्पिटल यहाँ पर तैयार हुआ। इसके पहले हमारे मुख्यमंत्री उत्तर प्रदेश श्री योगी आदित्यनाथ जी ने DRDO का जो लगभग 500 बेड का जो कोविड हॉस्पिटल बना है उसका भी उन्होंने लोकार्पण किया था। यहाँ पर जो लगभग 25 वेंटिलेटर्स और अप्रॉक्सीमेटली 100 के आसपास यहाँ पर HFNC यानी जो क्रिटिकल जो केसेज होंगे इनके ट्रीटमेंट की यहाँ पर बहुत ही अच्छी व्यवस्था की गई।
Chief Minister Yogi Adityanath was also present on the occasion. Here's more from our Lucknow correspondent.
The hospital, constructed in Hajj House, is equipped with L2 and L3 bed facilities, including 25 ventilators, 100 high-flow nasal cannula, and 130 oxygen-supported beds. Further, the hospital has triage, help desk, and control room to monitor COVID patients through CCTV. Yesterday only, Pandit Rajan Mishra COVID Hospital at Banaras Hindu University, Varanasi had been made functional. The 750-bed hospital was set up by DRDO. The armed forces are providing specialists, doctors, nursing and other medical staff moved from across the country on a war footing to run the hospital in coordination with Banaras Hindu University and the civil administration. Sushil Chandra Tiwari, AIR News, Lucknow.
Minister of State for Development of North-Eastern Region, Dr. Jitendra Singh, has said that the ministry is proactively assisting all the 8 northeastern states to fight the second wave of COVID-19 effectively. Chairing a review meeting with the Chief Secretaries, the Health Secretaries and the Central Government officers on COVID preparedness, Dr. Singh informed that Japan and the United Nations Development Programme have partnered to provide 8 oxygen generation plants to ensure uninterrupted oxygen supply at hospitals in the northeast. These plants will support more than 1,300 hospital beds across the region.
The centre has engaged with Indian Academy of Pediatrics to provide expert care to children at government child care institutions across the country. Women and Child Development Minister Smriti Irani said this will be in addition to medical care provided to children under a scheme for child protection services. She said caretakers and child protection officers, even from the remotest corners of the country, will be able to avail this telemedicine service by expert pediatricians every afternoon, 6 days a week.
In order to address the surge in demand for medical oxygen, the centre has undertaken key measures to increase the availability, streamline the distribution and strengthen the oxygen storage infrastructure in the country. The Commerce and Industry Ministry said the steps undertaken focused on the entire oxygen supply chain, including efforts for improving oxygen production, enhancing tanker availability to optimize logistics, improving oxygen storage at the last mile, and easing norms of procurement. Oxygen availability has been enhanced by increase in production capacity and production, setting up of pressure swing absorption (PSA) plants, import of liquid medical oxygen from overseas, and procurement of oxygen concentrators. We have a report.
Oxygen digital tracking system has been set up for real-time monitoring and driver availability is being enhanced with training of MHV drivers. For improving oxygen shortage, number and capacity of cryogenic tankers at hospitals is being enhanced and medical oxygen cylinders are being procured. Relaxation of general financial rules has been undertaken to enable faster procurement of critical supplies. 50,000 metric tons of liquid oxygen is being imported from overseas with orders and delivery schedule for 5,800 metric tons finalized. Procurement of 1 lakh oxygen concentrators has been sanctioned under PM CARES Fund on 27th of last month. 1,594 PSA plants are being established to improve oxygen supply near demand clusters. With Dipendra, Suparna Saikya, AIR News, Delhi.
The Railways has delivered nearly 5,735 tons of liquid medical oxygen so far to various states across the country. The Railway Ministry said more than 90 oxygen expresses have already completed their journey. It said Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states. The ministry said oxygen expresses yesterday delivered 755 tons of liquid medical oxygen to the nation. The first oxygen express to Uttarakhand is expected to reach tonight with 120 tons of oxygen from Tatanagar in Jharkhand.
The centre is continuously engaged in expeditious allocation and delivery of medical equipment and medicines to the states and union territories received from various countries to fight COVID-19. The Union Health Ministry in a statement said that a total of 9,200 oxygen concentrators, 5,243 oxygen cylinders, 19 oxygen generation plants, 5,913 ventilators and BiPAP and 3,44,000 remdesivir vials have been dispatched to the states and union territories so far. More from our correspondent.
The Government of India is receiving international donations and aid of COVID-19 relief medical supplies and equipment since 27th April from different countries to augment its efforts in fighting the surge in COVID cases in the country. The government is ensuring a streamlined and fast delivery of the global aid through faster custom clearances. The process of immediate allocation and streamlined delivery to the recipient states and institutions is being comprehensively monitored on a regular basis by the Health Ministry. Besides, a dedicated coordination cell has also been created in the Ministry to coordinate the receipt and allocation of foreign COVID relief materials. Anand Kumar, AIR News, Delhi.
INS Kochi and Tabar reached New Mangalore port today with critical medical stores. Both ships with cumulative consignment of 100 empty liquid medical oxygen in 5 containers and 1,200 oxygen cylinders had departed Kuwait for India on the 6th of this month. India has expressed gratefulness to traditional partner Kuwait for the consignment. Further, a total of 58 ventilators arrived in India today from Luxembourg and 5 lakh Favipiravir tablets also arrived from UAE. India has welcomed the gift.
Prime Minister Narendra Modi today held a telephonic conversation with his Bhutanese counterpart, Dr. Lotay Tshering. The Bhutanese Prime Minister expressed solidarity with the government and the people of India in their efforts against the recent wave of COVID-19 pandemic. Prime Minister Modi thanked the people and the government of Bhutan for their good wishes and support. Both the leaders noted that the present situation has served to further highlight the special friendship between India and Bhutan, anchored in mutual understanding, shared cultural heritage, and strong people-to-people links.
Prime Minister Narendra Modi will not attend the G7 summit to be held in Cornwall in the UK in person. In response to media queries, External Affairs Ministry spokesperson Arindam Bagchi said the decision was taken given the prevailing COVID situation. UK Prime Minister Boris Johnson had invited Mr. Modi to attend the G7 summit as a special invitee.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Centre asks states and union territories to give priority to those awaiting second dose of COVID-19 vaccine. Tells them to reserve at least 70% of vaccine supplied by the centre for second dose vaccination. Panchayati Raj Ministry writes to states to take preventive measures to curb spread of COVID-19 pandemic in rural India. Early trend of decline in daily new COVID cases and deaths noted in the country, says the Health Ministry. Over 356,000 people recovered from coronavirus in past 24 hours. Government proactively assisting all 8 northeastern states to fight second wave of COVID-19. Telangana government to impose complete lockdown in state from tomorrow for 10 days. Nagaland government also announces total statewide lockdown for a week from 14th of this month. Prime Minister Narendra Modi thanks his Bhutanese counterpart Dr. Lotay Tshering for support in wake of COVID-19 pandemic. Commerce and Industry Minister Piyush Goyal holds meeting with export promotion councils to discuss issues concerning international trade. And at least 8 people killed in school shooting in Kazan city of Russia. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Telangana government has decided to impose complete lockdown in the state from tomorrow for 10 days. Lockdown will be relaxed daily between 6 a.m. and 10 a.m. for all activities. The decision was taken in the state cabinet meeting chaired by Chief Minister K. Chandrasekhar Rao, has also decided to procure vaccines on war footing by calling global tenders immediately. The cabinet also approved setting up of a state-level task force headed by Industries Minister K. Tarakarama Rao to monitor the supply of medicines like Remdesivir and COVID-19 vaccines on daily basis. Here's more from our Hyderabad correspondent.
Announcing guidelines, the state government exempted all activities of agriculture sector, medical and health services, essential services like drinking water supply and power supply from the lockdown. Public transport like RTC buses and metro rail can operate between 6 a.m. and 10 a.m. daily. However, transportation can be as usual on national highways, while petrol and diesel pumps will remain open. Activities of print and electronic media have been exempted from lockdown. Government offices will work with 1/3 staff, while banking sector including ATM activities will function normally. Marriage functions can be held but with maximum attendance of 40 people. Similarly, funeral activities can be held with maximum attendance of 20 people. Cinema, clubs, amusement parks and sports stadia will remain closed during the lockdown. Lakshmi, AIR News, Hyderabad.
The Nagaland government has announced total lockdown in the entire state for 1 week from the 14th of this month. The decision was taken in the meeting of High-Powered Committee on COVID-19 in Kohima today. A press statement issued after the meeting said complete lockdown will be imposed in the entire state from 6 p.m. on 14th of May and will continue till 21st of May.
The Himachal Pradesh government has put in all efforts to prepare facilities for controlling and preventing COVID-19 infection, building the infrastructure for quarantine and treatment of infected patients. Our correspondent reports that an oxygen plant sanctioned by the central government for the state would be established soon by the DRDO. We have a report on this.
To manage the upsurge of fresh cases in the second wave, focused endeavors have been made to increase treatment facilities in the state. Enhancement of COVID facilities being made in the state in a time-bound manner in order to provide quality health service to the individuals. Presently, the state has 30 dedicated COVID health centers. Out of these, makeshift hospitals have been established in Lalagar, Palkwa, IGMC Shimla and RPGMC Tanda. Also, 4 DCHC new makeshift hospitals are soon going to be established in district Una, Mandi and Kangra. The state government is trying to enhance bed capacity by 1,100 in makeshift hospitals. Currently, the state has 3,700 beds available in various health institutes of the state and occupancy is almost half. On the other hand, the state is producing 75.81 metric ton oxygen per day, while the consumption is 27.83 metric ton per day. Sanjeev Sundaryal, AIR News, Shimla.
In Jammu and Kashmir, Lieutenant Governor Manoj Sinha today announced a slew of measures to mitigate the suffering of families who have lost their loved ones due to COVID-19 pandemic. The Lieutenant Governor said that senior citizens who have lost only earning member of the family will be provided special pension for life, while children who have lost their parents to this calamity will be provided with special scholarship by the government. More from our Srinagar correspondent.
Lieutenant Governor Manoj Sinha said that since the global pandemic has rendered thousands of daily workers jobless, so keeping that aspect in view, his administration has decided to provide 1,000 rupees per month to all registered construction workers, poniwalas, palkiwalas, pithuwalas for the next 2 months. He further said that the government is also adopting other mitigation strategies and all concerned officers have been directed to ensure the supply of ration to all ration card holders on priority basis. He added that installments of social welfare schemes like Old Age Pension, Lali Beti, PMAY and MG Narega and other welfare schemes will be released immediately. Sunil Kaul for AIR News from Srinagar.
In Assam, the first cabinet meeting of the Himanta Biswa Sarma government was held in Guwahati today. Talking to news persons after the meeting, Health Minister Keshav Mahanta said the Chief Minister Himanta Biswa Sarma instructed all ministers to visit 2 or more districts each to monitor COVID situation. All the ministers will submit report within 3 days to the Chief Minister.
Due to limited availability of Covaxin, the Maharashtra government has decided that people in the age group of 18 to 44 years will no longer be administered the Bharat Biotech made indigenous vaccine. More from our Mumbai correspondent.
Maharashtra's Health Minister Rajesh Tope today said that about 3 lakh doses procured for the 18 to 44 age group will be diverted for the use of people above 45 years of age who are awaiting their second dose of Covaxin. Speaking to reporters in Mumbai, Mr. Tope informed that more than 5 lakh people from the 45 above age category are awaiting their second dose. The minister said it is important to administer the dose within the stipulated 4 to 6 weeks' time to ensure that the vaccine's efficacy remains unaffected. Maharashtra has so far inoculated 1.8 crore people, including about 4.5 lakh people from the 18 plus age category. Nisha Rani, AIR News, Mumbai.
In these distressing times of coronavirus pandemic, all persons require a small ray of hope to believe that the worst will soon be over and normalcy will return. Well, a sports teacher at Sonapant Dandekar College from Palghar district in Maharashtra, Kiran Thorat, brings such hope by helping patients seeking blood or plasma donations. The sports teacher not just managed to arrange 300 units of blood for those in need, but also plasma for 800 COVID patients. Let's hear what Mr. Thorat has to say about his experience.
मुझे खुशी होती है कि इस 13 महीने में मैं कुछ अलग कर पाया और इस कोरोना के पेंडेमिक में मेरे रक्त कर्णदाता ग्रुप है उसके माध्यम से हम ऑल ओवर महाराष्ट्र अभी तक 800 लोगों को प्लाज्मा दे चुके हैं अरेंज करके और 300 लोगों को ब्लड दे चुके हैं। मेरी एक विनती होगी तो जिन को हमने और हमारे जैसे लोगों ने प्लाज्मा अरेंज करके दिया है, आपका पीरियड कंप्लीट होने के बाद आप खुद प्लाज्मा दाता बने जो कि आज समाज की जरूरत है वो पूरी हो सके।
A total of 12,481 new confirmed cases of coronavirus infection were reported in the national capital during the last 24 hours, taking the total number of cases to over 13,48,000. In the last 24 hours, 13,583 people recovered and 347 deaths were reported in the city.
The BJP today accused the Congress of being inconsistent on the issue related to fighting COVID-19 pandemic. Briefing media, party spokesperson Gaurav Bhatia questioned senior Congress leader Rahul Gandhi for demanding lockdown to check the spread of COVID, saying earlier he had opposed the measure. Another party leader, Meenakshi Lekhi, came down heavily on Delhi government over the poor health infrastructure in the national capital.
Amid the COVID-19 pandemic, the biggest challenge is to remain positive. To boost the morale of people during this challenging time, COVID Response Team, CRT, an initiative of civil society, has organized a 5-day lecture series which began today. This initiative, titled Positivity Unlimited Hum Jeetenge, is aimed at promoting positive thinking in the society. The lecture series will be broadcast daily on 400 media platforms from 4:30 p.m. to 5 p.m. This would culminate on 15th of May with the address of Sarsanchalak of Rashtriya Swayamsevak Sangh, Dr. Mohan Bhagwat.
University Grants Commission, UGC, has clarified that it has not issued any guidelines on examinations recently, and the news circulating in print and digital media about this is incorrect. It had issued guidelines on examinations and academic calendar from time to time during the last year.
The second wave of COVID-19 has raised concerns about its impact on the economy of the country. Talking to All India Radio News, Secretary General of the Federation of Indian Chambers of Commerce and Industry, FICCI, Dilip Chenoy, said in the first wave the country was not aware about the nature of the coronavirus and how to respond to it. He said, however, in the second wave the government and the traders are well aware how to function with all the safety protocols in place.
अगर आप छोटा मार्केट है, आप उसको डिजिटली एम्पावर करिएगा, बोथ डिलीवरी और पेमेंट के लिए, और अपने कस्टमर से डिजिटली कनेक्ट करिएगा, तो उससे जो आपके ऊपर इम्पैक्ट होगा वो काफी कम होगा. तो एक तरीके से कैश कंजर्व करिएगा.
The centre has said that nearly 22,215 crore rupees in Punjab and 12,384 crore rupees in Haryana have been transferred directly into farmers' account so far against sale of their wheat crop. The Ministry of Consumer Affairs, Food and Public Distribution in a statement said, in the ongoing Rabi marketing season 2021-22, the Government of India is continuing to procure Rabi crops at MSP from farmers as per the existing price support scheme.
Commerce and Industry Minister Piyush Goyal today held a meeting with the export promotion councils to discuss various issues concerning the international trade. Mr. Goyal complimented the exporters for their encouraging performance even during such trying times. He noted that India's merchandise exports in April this year was $30.21 billion. This is an increase of 197.03% over $10.17 billion in April last year and an increase of 16.03% over $26.04 billion in April 2019.
In Russia, in an incident of shooting at a school in Kazan city this morning, at least 7 children and a teacher have died. According to officials, several others were injured and taken to hospital. A teenager was detained after the attack at the school, which is approximately 800 kilometers east of Moscow, located in the majority Muslim Republic of Tatarstan. The accused is a 19-year-old registered firearm owner. Tatarstan President Rustam Minikhanov described the shooting as a tragedy. Responding to the attack, Russian President Vladimir Putin said he will review the country's gun control laws.
Now let us have a look at the weather forecast for tomorrow. National capital Delhi will see generally cloudy sky with rain. The minimum temperature in the national capital will be 24 and maximum 37. Mumbai will have partly cloudy sky. The temperature will be from 27 to 35. Chennai will have generally cloudy sky with rain or drizzle. Kolkata will see rain or thunderstorm with strong gusty winds. Jammu will have thunderstorm with rain. Srinagar will see generally cloudy sky with moderate rain. Leh will have generally cloudy sky. Gilgit will see a generally cloudy sky with 1 or 2 spells of rain or thunder showers. Muzaffarabad will have thunderstorm with rain.
And now, before we end the bulletin, the headlines once again. Centre asks states and union territories to give priority to those awaiting second dose of COVID-19 vaccine. Tells them to reserve at least 70% of vaccines supplied by Centre for second dose vaccination. Panchayati Raj Ministry writes to states to take preventive measures to curb spread of COVID-19 pandemic in rural India. Early trend of decline in daily new COVID cases and deaths noted in the country, says the Health Ministry. Over 3,56,000 people recovered from coronavirus in the past 24 hours. Government proactively assisting all 8 northeastern states to fight the second wave of COVID-19. Telangana government to impose complete lockdown in state from tomorrow for 10 days. Nagaland government also announces total statewide lockdown for a week from the 14th of this month. Prime Minister Narendra Modi thanks his Bhutanese counterpart Dr. Lotay Tshering for support in wake of COVID pandemic. Commerce and Industry Minister Piyush Goyal holds meeting with export promotion councils to discuss issues concerning international trade, and at least 8 people killed in school shooting in Kazan city of Russia. And with that, we end the evening news. Good night.